I'm just so thrilled and excited about you being here with us today. For those that they don't know me, and my name is Mana Fouad. I'm a Senior Associate Dean for Diversity and Inclusion at the Hersing School of Medicine at our school. I'm also a professor in medicine in the Division of Preventive Medicine. So we're so excited about the kickoff of our staff grand rounds. This is our first one that we do. It's really this grand round is going to be dedicated to the professional development of our staff. And really that what we're hoping this grand rounds would do, it will really engage us another to offer educational content to the staff members or any other topics that hopefully you're going to help us to look at, and you can recommend so we can do them in the future grand rounds. So we are just beginning to do that. So this is going to be helpful to us. So this grand rounds for who? It's for our staff in the Hersing School of Medicine. If you're a beginning in your career or you're seasoned in your area of work, so you are welcome. I was just going to ask you if you can mute your speaker. Would be helpful to us. I just really want to thank our Staff Diversity Liaison Committee for managing the content of this meeting, and also want to really thank Dr. Leisha Haldgren, our director of the ODEI office, because she spearheaded establishing our staff liaison and been meeting with them on a regular basis. I also want to thank Mary Hillier. She's our office coordinator for coordinating this. But just to give you an idea about our staff liaison, this is a group of staff members that they represent each department and unit in our Hersing School of Medicine. And they were recommended by their chair. So they represent you. So I hope that you would know who's the person in your department and unit, so you can give them feedback so we can move forward with any new topics or issues that we need to discuss and get back to you. So one of the responsibilities is going to be to get information from you and recommend topics and speakers for the staff grand round series. So with that, I don't want to take a lot of time to talk about our office, but mainly today we're here because we are very fortunate to have our today's speaker, which is going to be our speaker for our inaugural grand rounds for our staff, Dr. Megan Hayes, who is the Associate Director of Education at the UAB Medicine Office of Wellness. She has other jobs too in the school, but I'm going to focus on this today. Dr. Hayes supports our faculty, students, and residents by providing services such as coaching and stress management. She also offers her expertise for speaker sessions like this one and provides talks on a variety of issues, like mental health, emotional health, and professional development. And today we are excited to hear from her on topics of joy and how we can find joy in our daily lives. I remember my chair of department always says, I want you to have fun, when you come to work. I hope that you, and this is really very important. So as I mentioned, and joy help us to feel fulfilled in our work and be, feel like it's not a burden, but it's an easy thing for us to do. She also would talk to us about how to beat burnout and stay on the track of feeling joyful. So I want to thank Dr. Hayes so much for agreeing to do and kick off our series today. And hopefully we'll have 10 minutes at the end for questions and answers. So if you want to write your questions in the Q&A or in the chat, and we will get to them as many of them as we can. So thank you, Dr. Hayes. Welcome.
Thank you so much, Dr. Fuad. And I'll go ahead and share my screen with you all real quick and do the obligatory, can you see this? So let's see.
Yes, we can see it.
Okay, you can see it. Okay, that's always a good start. All right, thank you so much for this warm welcome. I truly feel honored to be the speaker for this inaugural staff Grand Round series here at HearSync. I think that staff professional development is so important. This is something that is near and dear to my heart, so it definitely aligns with my values to be here and to hopefully share with you all some information about burnout. And we will be talking about finding joy in your job and life again, right? I say again because sometimes we can lose sight of that, right? And we've been through a lot with the COVID pandemic, especially in the healthcare sector. Some of you may be hurting still from that. I know that many of us are. And I want to just give you guys, put some of that into perspective, because burnout is definitely a barrier to finding joy in your job. It's a barrier to finding joy in your life as well. And so I hope that we can talk more about burnout, where it comes from and what to do about it, so that we can, ignite some more excitement, engagement, and joy in our work. So with that, I'll first talk to you all about the multi-level factors that tend to contribute to this phenomenon of burnout and distress in the workplace. I want you guys to understand some of the signs of burnout and distress in yourselves, but as well as the people around you at work, just to know what it might look like. Of course, I want to talk about some evidence-based strategies for managing that burnout if you're dealing with it. And well, maybe to prevent it too, right? These are all just good things to prevent it. And also to explore some of those practical tips for finding joy in your job again, or to at least reignite some of that joy you might have once had. And then I do want to try to save at least 10 minutes for questions at the end. I guess I was on mute. Okay, can everyone hear me now?
Yeah, I could hear you the entire time.
Okay, I don't know, I got a message to unmute, so thank you. All right, so moving on. So what is burnout? So burnout is actually not a medical diagnosis. So something to know about it is that it is a stress response. It is a human condition. So it's not something that I, as a psychologist, could go look up in the manual that we use for diagnosing folks and say, okay, this person is burned out. So that's something that I want to definitely stress. And even if you notice some of the symptoms I'm going to mention yourself, I think it's important to know that it doesn't mean you have a disorder, right? That you have burnout. It is actually just a response to certain conditions, right? It's a response to job stressors that haven't been adequately managed or resolved. And there's multiple reasons for it. But a lot of people are throwing out burnout these days. It's a big buzzword. And I think sometimes it can even be overused. But I think people, when they say it, they know it means something bad, right? They know that they're feeling something not great. But I wanted to give you an idea of exactly what burnout looks like, just so we're starting from the same space. So for something to be burnout, it actually consists of 3 different dimensions. And the first dimension is emotional exhaustion. This is that feeling of just being completely wiped out after work or exhausted by your work. You can see the little graphic that I have there. I think it probably displays emotional exhaustion pretty well. I'm spent and I don't really have much else to give, especially by the end of the day rolling on, but also like that trouble dragging yourself to work. The second dimension is the cynicism and depersonalization dimension. This is when people start to feel a lot of negativity towards their jobs. They start to, kind of have this whole take this job and shove it mentality. It can be really hard to be in this place, right? To be able to see the positive aspects of one's work. But the other side of this dimension is also that like detachment. So that depersonalization dimension, but this is more of like a numbing feeling detached from your job, from the patients, maybe your coworkers, from your meaning. And that can also be a real challenge to finding joy in work. And then the third dimension of burnout is what we see this reduction in our what we call personal efficacy, our professional efficacy, and our sense of accomplishment. So what this means is this might look like, well, maybe I'm not very good at this job. Maybe I made a mistake coming here or agreeing to do this job. Maybe it's not for me. And sometimes you can see a little bit of like that imposter phenomenon here. But really, you could be working as hard as you possibly can, but you're still feeling like the work you're doing isn't making a difference or that it's not good. So that can be a problem as well, as you could imagine, and make it really challenging to be motivated to do your work. So I just have a few questions here. So we talked about the 3 dimensions, but some questions that come out of the Mayo Clinic that can be used to help identify burnout, just so you understand. So we have this, have you become cynical? Have you become critical at work? Are you dragging yourself there? Are you having trouble getting started? Have you become increasingly more irritable or impatient with your coworkers or your patients? Do you feel like your energy is just so zapped on a consistent basis that it's difficult to be productive? Is it really becoming hard to concentrate at work? Are you feeling like even when you've achieved some things that they just don't matter, they're meaningless, you're not getting much satisfaction out of that? Are you feeling kind of disillusioned about the work? Like you thought it was going to be one way and it's not that way at all, right? It's not good. Are you using things to try to avoid your feelings? Are you using or to try and feel better, right? An attempt to feel better. Maybe that's food, like binge eating style, or maybe it's even drugs or alcohol, right? Substances. Are you using your phone, right, in an unhealthy way, or social media and doom scrolling just to try to avoid your feelings or to not feel at all, right? Try to disconnect. Have you noticed some changes in your sleep habits? Is your sleep getting worse and there's really no other way or reason that you can think of that might be causing that? And, kind of along those lines, are you having some unexplained physical complaints? So a lot of times, one thing I'll point out about all of these, number one, if you have some of these sometimes, or even for a short period of time, these are okay, right? It's not, and even 1 or 2 of these here and there, like the odds that all of this is going to look perfect for us, it's probably pretty rare as like a working individual who probably has other responsibilities at home too. But what really becomes concerning is having a lot of these, answering yes to a lot of these on a very consistent basis. The other thing I want to point out is for the physical stuff, especially, or for really all of these symptoms, if it's not like you, and you really don't have any history of mental health concerns or medical issues, it's always worthwhile to get these things checked out by a physician. So that is one disclaimer, just to make sure it's nothing more serious. But with burnout, you can certainly have a physical manifestation of that, where I have clients coming to me and they're telling me that they just have, they don't understand the pain that they're having literally in their neck, right, or their back. They've been to the doctor. There's no explanation, from an organic standpoint. And a lot of times or GI, right? And unexplained GI. And a lot of times it is job related stress and or burnout. So really thinking of it in a broad scope, this isn't just like a mental health thing. It's really a whole person thing. We also know that burnout is very prevalent. And I am sure you guys are seeing a lot of these headlines, and certainly COVID. If we can say one positive thing that happened for well-being with COVID is that more of a light has been shined on well-being and issues such as burnout. But burnout is really nothing new, is another thing that I want to point out. Burnout has been studied for decades. And even the first research on burnout, of course, it existed before then, came out in like the 60s, right? So it's nothing new. But I will say COVID has helped kind of shine a light on these things, especially in healthcare. But we know that it's not like burnout wasn't prevalent before, but we've seen heightened rates since the pandemic. So we've seen across professions, and it's not just healthcare, but from the American Psychological Association Stress in America survey, they do this every year, and they found that an alarming number, a very large number of employees across professions have been experiencing things like work-related stress, that emotional exhaustion that we talked about, reported physical fatigue. So 44% of American workers were reporting physical fatigue, and that's very high. And people were reporting negative impacts of their work-related stress. And we know that some professions are more vulnerable than others. So we're in healthcare. you're living it, right? You're seeing it day to day. It's not just here at our institution. Healthcare is struggling right now. The landscape is very challenging, right? It's very exciting and meaningful work, but we also know that burnout is very high in our professions because we are in a caring profession. We care for other people, and that's at all levels of the institution. From the second a patient checks in, right, or has that first, picks up the phone and makes a doctor's appointment, we are encountering these patients at every level, and that takes a lot of work and caring. We also know that teaching is another one of those, human service workers, as well as first responders. So we heard a lot about these groups in the pandemic. And one other thing that I want to point out, and this isn't technically a job, right, but parents, and that's why I didn't list it here, but we also know that parents are definitely more at risk for burnout, especially those parents who are working. And I know that I have felt that firsthand, having had a baby last year. And this statistic is about turnover. You've probably seen some headlines such as like quiet quitting, the great resignation. And, in healthcare, we know that 1 in 5 nurses left the profession during the peak of COVID. But, kind of nationwide and across all professions, the turnover and tension is pretty high right now. More than 2 in 5 workers are planning to change jobs in the next year. So at a broad level, one thing that I really want to point out is that burnout is not a you thing, typically, right? I think for a very long time, multiple corporations and employers held this view that the job is what it is. And if you're burned out, it's kind of a you problem, and you need to be more resilient, and you need to solve that, kind of yourself. Thankfully, we're in a different landscape. Obviously, you can see the enormous, tremendous effort that UAB Medicine is making to target wellness efforts and to address engagement in our workforce. I think we do an excellent job. Maybe I'm biased, but that doesn't work to just focus on the individual, right? And that's one thing that I want to point out. So we know that we need systemic change. And what it really comes down to is a mismatch between you as an individual and the work, right? Or the institution. So that mismatch between the work and the worker is what's really critical. So a lot of people ask me, is it the job or is it the worker? And that's kind of the wrong question, because in reality, we need to be looking at both. And it's really about finding a fit that works for you. So the first factor that we've seen time and time again, and this is from old literature, you can see the citation, 1999. But one factor that everyone thinks of first, and we think of right away, as workload. So absolutely, right? If you have too much to do and not enough resources or people to do it, then you're going to be at higher risk for burnout. And that makes a lot of sense. But these other 5 factors I'm about to talk to you guys about sometimes matter even more than workload, and they're not always as thought about. So I definitely want to emphasize those. The second one I want to emphasize is control. So control comes down to autonomy. How much say do you have over the work that you're doing? Do you have the opportunity to go to your supervisor and say, hey, I don't really love this aspect of my job, but I'd really like to be doing more of this? Right? Are you going to be able to have that discussion with your supervisor? Are you going to have some control over the work that you do day to day? Are you able to kind of pick some passion projects? Of course, we all have some work we don't love, but are you able to have some control over certain aspects of your work? And that's very important. So reward, this can be thought of not so much as about pay and perks necessarily, although it's nice to be paid a fair wage, of course, and that is important. But what we're talking about often more so here is recognition, like social recognition and reinforcement of a job well done. So this looks like, do you feel valued by the people who work around you? Do you feel valued by the patients that you're interacting with? Do you feel valued by leadership, right? And the next factor, because we just talked about your kind of the people around you at work and giving thanks and being recognized as being important, but that's your workplace community. So these are the people that you are in regular contact with, or you have frequent interactions with at work. This could be your colleagues. It could be the people you're supervising. It could be your clients or your patients, your customers, however you want to think of it. But is your environment a supportive one, or is it a toxic one? right? And this can really vary across departments and divisions as to how people are feeling supported. But we know that that workplace support is so protective and important for avoiding burnout, or if you're having it, for managing it. The fifth factor is fairness, and this would cover issues that are very important, such as discrimination or inequity in the workplace. So those large issues, right? But it also can include things at the individual level, like, am I getting acknowledged for the contributions that I make to the workplace, or do other people get praised for the work that I'm doing while my work goes unnoticed? Is someone else getting regular deadline extensions or access to additional resources when I'm not? Is my pay equitable? Are there opportunities for advancement for me? And so when we start to not have these things that are not looking fair, it can definitely lead to feeling disrespected and undervalued by an institution. And it can lead to more of that cynicism that is associated with burnout. And the last factor we see time and time again in the literature is values, right? So this has to do with how well the work that you are doing is aligned with your most deeply held values. There can be a mismatch when you are asked to do things that you feel are not right for you, that just don't feel right in general, that conflict with your beliefs as a person, or if you're frequently seeing unethical behavior. This is where moral injury can occur in the workplace. And you may have heard a lot about that during COVID. And if you have like strongly held values that differ from those in the leadership of your organization, or at least what you're perceiving as their values, then that can be a mismatch and definitely increase your risk for burnout. So all 6 of these things matter a lot. And so if you're thinking to yourself, well, I'm feeling kind of burned out, you may want to be thinking of these 6 factors and where is the mismatch and what can be done about it, as I talk to you about some individual strategies coming up. And it wouldn't be a talk on burnout lately if I didn't mention a few COVID specific things. But we also know, of course, like the factors I just mentioned, they've been around for decades. We see those time and time again, and we saw them during the pandemic as well, even in our pulse survey results. But we also know there are some COVID specific things that tend to push those burnout levels over the edge. So early on, it was stuff like the PPI, the risk of infection. We didn't have the vaccines yet. We didn't have the treatments. We were seeing a lot of new variants. People were struggling to get childcare, speaking of parental burnout. And of course, that increased workload, but there are still issues, right, that are ongoing, that are a result of the pandemic, or at least related to it in some way, shape, or form. So we've seen, and maybe you guys have experienced this yourself, but some increase in mistreatment and violence towards our healthcare workers at all levels, right? And so I know you as staff have certainly probably seen this, heard about it, or have dealt with it yourself, unfortunately. So that can really drag us down, right, and contribute to that burnout feeling. Short staffing is still going on. It's just so hard to get positions staffed at the moment. There's a labor shortage. People are still dealing with childcare because there's a childcare shortage of people to work in daycares and things like that. We're still seeing some anti-science attitudes. I think maybe they've cooled off a little bit from what I've seen, but it's still going on. And then, of course, we have inflation, which is always fun for multiple reasons. So we know kind of the bad news and some of the things that are contributing to these feelings of burnout. And one of the things about burnout that I think is great, is that everyone wins when we address it. Like you as individual employees win, and the institution at large wins. There's really no reason not to address it. So I'm so glad that there's so much attention that is being paid to this topic. So at the individual level, I think some of the benefits are just being able to know what burnout is, to reduce it, to identify the signs early before you really, are struggling. It's led into other issues like depression, anxiety, or even physical medical issues. I think it helps us to increase our compassion, and our empathy. We can reconnect with the purpose in our work. We can, once that barrier is removed of that burnout, we can get back to that place of really enjoying what we do. And of course, we're going to see an improvement in our physical and mental health when we address it. Now, on the employer side at the UAB Medicine, for example, I know this is going to be important to any hospital, right? We're going to see less turnover of our staff when we address well-being and make jobs, make it a good place to work. We're going to see less cost to recruit and replace people. And guess what? Our consumers, in this case, our patients, are more satisfied, right? We know that when we have a burned out team, that patient satisfaction plummets. So this is really important. Also, medical errors, right, or errors administratively, improve performance with staff. All of these things get better when there's less burnout and we're addressing well-being. And then therefore, there's less need for disciplinary action. So for all those leaders who are listening today, there's so many reasons even to address this in your unit or in your department, right? That there's really a win-win for both sides. And it's definitely something that should be invested in. So we kind of know a lot about burnout now, but where do we go from here? What can you guys take away? You know, that's kind of a broad level, but what can you take away as individuals? So I'm going to get into that. But the absolute last thing I am here to tell you today, if you're feeling burned out or you felt that before, it's just to be more resilient and that it's a you problem. I mentioned that earlier. That's a real big pet peeve of mine. I'll kind of give you another example. So I know, something that kind of fell flat recently. Amazon's a very large company, and they put these like Zen booths in their warehouses because the workers, were having so many issues with this burnout and like dissatisfaction in the workplace. And the Zen booths, guess what? They didn't work, right? Because fine, you can go into a Zen booth for a few minutes, but then you come out and the job is still the same, right? So the last thing I'm here to tell you is that you need to work on your resilience. But what I will say is that systemic change takes time. And believe me, people are working on it here. But what can you do in the meantime? And there are a lot of things in our control, and even as how we relate to our jobs. And the first thing that I'm going to start with is physical health. But please realize that physical health and mental health are inextricably linked. These things impact one another significantly, right? If your mental health isn't great, your physical health's not great, and vice versa. But I kind of just have these grouped in categories to help you remember and to help put this into context. So you got to take care of you first, right? If you're feeling burned out, it's time to take a step back and get back to the basics. Because one thing that happens when we're burned out is we tend to start to treat our needs, our basic human needs, as nice to have, right? And that is absolutely not the case. These things are not luxuries. I want you to consider pressing the reset button for your body and your mind by considering some of these domains. And the first one that I'm going to throw out to you is exercise. And I know, another talk talking about the importance of exercise, but truly this is an evidence-based strategy and technique is the way that I want you to think of it for managing your stress. You may have heard the quote that zebras don't get ulcers because they run when they're scared. There's really nothing that exercise doesn't help us in a lot of ways. Like it's just kind of one of those things, like if I could put it into a pill, I would. It would probably help so many people. But the barrier is often, how do I get started? Because you're tired, right? If you're burned out, you're tired. So the first suggestion I would say to you is to do something easy. And I put easy in quotes because doing anything when you haven't been doing much physically is tough. And I know that. But think about like the least aversive thing. Okay, maybe I can agree to do a little 10-minute walk along the UAB walking trails through the sky bridges. So it's a zillion degrees outside. But I can agree I'm going to do 10 minutes, maybe after lunch each day. I will have my lunch and I will devote 10 minutes to walking through these sky bridges and go back to my office. Maybe that's doable, right? Or maybe walking doesn't sound great to you, but swimming does. Or, taking your kid on a walk in the stroller when you get home at the end of the day and it's not as hot, right? Try doing something new, maybe something you've never tried and that you might enjoy. Whatever it is, think about SMART goals, right? I'm sure you've heard of SMART goals. We're not trying to set a goal that is absolutely unattainable. Start with something easy. Just try to get some mindful movement into your day of some kind and build from there. Sleep, this is definitely one of those things that is treated like a nice to have and it absolutely shouldn't be. I probably should have reordered sleep above exercise, because if you only have time to really prioritize one wellness behavior in a particular morning, let's say, I would prioritize getting that extra hour so you can get the full night of sleep, because sleep is so related to our mental and our physical health. It makes us slower the next day. It hampers our attention ability, and it honestly can keep that cycle of burnout going because the work just never seems to end. You're up all night. You're not shutting your computer down on time. You're not getting enough sleep. And the next day you're even slower. So my task for you with sleep would be to really try for 7 to 9 hours. And by try, I mean have boundaries, right? So set an alarm to go to bed. And when that alarm goes off, no matter what you're doing, it is time to go ahead and bring yourself to the bedroom and go to sleep, right? Turn off the phone. So try that out. And I put beware of revenge bedtime procrastination. This is something for anyone who's on social media. You may have seen some reels about this, but this is that phenomenon where we finally get to the end of the day. And if you have kids, the kids are asleep, or you're done with work and you're closing the laptop, but it's finally your time. And so now it's like an endless scroll of whatever you want to do, Instagram, YouTube, Netflix. And it feels annoying that you have to turn that off because it's finally your time, right? I've been there too. But you will absolutely thank yourself for getting that CDC recommended 7 to 9 hours, somewhere in that range. It is worth it. You will be able to help reverse that cycle of like that feeling tired because you probably have a sleep debt, right? And so we've got to reverse that. Waking up at the same time every day, even on weekends, right? If you're struggling with sleep, this is like one of the top tips that I can give you. It's really annoying to wake up kind of early on the weekends, but if you want to get your circadian rhythm back on track, this is a great way to do that. And when I say the same time, I mean within a wiggle room of about an hour. So let's say you typically wake up at 6 a.m. for work during the week. Try to get up by about 7 on the weekend. This way you are not crossing multiple time zones, right? So if you think about if you slept in 3 extra hours, you've now basically gone to Pacific plus time, right? You were 3 hours, kind of out in terms of jet lag. So when you have to wake up Monday, that's why we feel that kind of Monday jet laggy feeling. It's called social jet lag. So try to wake up around within an hour's time of the same time every day. In terms of sunlight, sunlight is often forgotten about, but what I would tell you is to aim for 10 to 30 minutes of sunlight daily. Those with lighter skin tones probably only need about 10 to get the benefits of sunlight. Those with darker skin tones may need closer to 30 minutes. Why is sunlight important? Serotonin, right? So serotonin is produced when we have that broad blue spectrum sunlight that's beaming into our retinas. And that enables us to have a better mood, right? It's a mood booster. It enables us to pay attention. It also converts to melatonin at night, right? So that's that vampire hormone. That's that darkness hormone. So we're able to sleep better, actually. When we get more sunlight during the day, we end up producing more melatonin naturally at night, and we need that to fall asleep. So definitely trying to get that 10 minutes of sunlight at least. Anywhere from 10 to 30 is good. And my final point on physical health is to eat well, but not perfect. I think people get so caught up in all or nothing thinking with eating that, oh, I must eat perfectly all the time, or it's not even worth trying. But one rule that I really like as a psychologist is that what's called the 80-20 rule. 80% of the time, you are trying to make the better or best decision that you can for your health, right? Maybe it's choosing kind of something like Mediterranean dietish, like I'm going to go for the salmon, I'm going to go for the leafy greens and all of that 80% of the time. But 20% of the time, I'm going to be a human. And I also tell people that, 20% of the time, it's often better if you don't just save that for Saturday, right? Saturday and Sunday, because that can lead to kind of an on-off mentality. It's honestly better if you kind of integrate that 20% into each day. Like, all right, well, I'm going to have, this is my 20%. I'm going to have this dessert I've really been eyeing, and I'm going to honor that because truly some foods, feed the soul, and we want to avoid that binge mentality of I can't have that. Pay attention to how you feel, right? Try mindful eating, even if it's just for a snack. Really sit with your food, turn off all distractions, and notice all the flavors and savor it. In terms of emotional health, what can we do to really tap into that? Well, one thing we can do is to connect with our values. What do you stand for? What are your core values? What is important to you, right? And anytime you're thinking of doing something, or you've been asked to do something and you're unsure, ask yourself, is this consistent with my most deeply held values? And this can help you decide whether you want to do it or not, right? And it's so important to know your values, because knowing them is like having a North Star, right? If we know what our values are, they can help to guide us back in the right direction when we feel like we're caught up in a storm, It means that we can connect with our purpose again when we stick with our values. So, for example, some values might be something like integrity or creativity or humor or, family, right? And so these are typically like one word. So really think of what your top 5 to 10 are and go with that, Another thing that's important is connecting with your meaning. Always remember your why. I've seen some of those signs up around the hospital, and I love to see that. We can get so lost in why we came into this field in the first place and why the work that we're doing is important. We can talk ourselves into thinking it's not, right? But we want to practice, and I try to do this daily. Like, what is one reason that I went into this field? That's it. It's a quick exercise, but it can help to reroute you. And it can be the same reason every day. You can also, like, when something that felt meaningful at work happens, write it down. Write down that inspiring story. Just jot it down and save it for when you need a day, you're having a rough day and you want to look back on it and think about how that was someone you helped, right? And something important you did that made a difference. Think about the unique skills you've got that you bring to the table. How do you make a difference in the workplace, right? We've all got our gifts, right? And so for me, I love just kind of being the humor person at work. I love to bring humor. I think that's a skill that I can bring to my department and to my division. What is it for you? Are you the one who can kind of keep calm in a crisis? Are you the one who somehow knows to always remember to bring everyone together when it matters the most? What do you bring to the workplace? Are you particularly good at just talking with distressed patients? So really reflecting on that. And another note is to be sure to connect with your emotions. This is a diverse group, right? You as staff, you do wear a number of different hats, and you probably have a lot of different types of jobs. And I have no doubt that many emotions come up day to day in your job. So you want to pay attention to those. Don't try to push them to the side, right? Take stock of what your feelings are. You can do this using mindful approach, just to note, I'm feeling anxious, I'm feeling sad. You can use some self-compassion. If you notice yourself being a bit critical of yourself, what would I say to a friend, right? And because usually we're going to be nicer to a loved one or a friend than ourselves. Or gratitude, right? So what am I grateful for today, especially when it's hard to think of what went well that day? And it may be something seemingly simple, like I have a house or apartment to go to. I've got shelter. I've got food to eat, right? I'm not food insecure. So what is it that you are grateful for? And that can help you as well. Just kind of a little sidebar that I like to say about emotional health. Positive vibes only, although it comes from a good place, doesn't really work. And the reason for this is that we don't want to wrestle with our emotions. We don't want to force ourselves to turn that frown upside down. There's actually research that when we set happiness as our goal, people who do that and they set happiness as their goal, they tend to be less happy over time. And the reason is because we have all of our feelings for a reason. They're all important. There's a reason we feel sadness sometimes. There's a reason we feel angry sometimes. We want to simply be able to move through these various emotions by acknowledging them, right? And there's a famous quote in psychology, Carl Jung, what we resist persists. I love that quote because the more we try to push these things away, somehow the more they come to get us, right? So it goes for trauma we've been through. It goes for feelings we have. So really don't try to push those down. There's no reason to. Simply feel your feelings is what you want to do. This is a quick little mini mindfulness technique that I love. This is great for if you're feeling overwhelmed, you're feeling kind of like you have so much to do on your plate, you've got a lot of emotions running high. This is just a quick grounding technique that you can use to get yourself back to the here and now. It gets you out of your head and into your body. And all you need to do is walk yourself through your 5 senses. Ask yourself, what are 5 things that I can see right now, and name them. What are 4 things that I can touch or feel around me? 3 things I can hear, 2 things I can smell, and 1 thing I can taste. And that's it, right? And that can just take a minute or 2. And what that will do is just get you back, right? Get you out of the thought spiral and back to the here and now. And so I love to use that at work when I feel like I've just got a million tasks on my plate, but I need a minute, right? And it's definitely worth it to reorient yourself to the present. Social health. This definitely deserves an entire section of its own. You guys may have heard the Surgeon General's advisory lately about the impact of loneliness and social isolation on our health, and that is our physical health as well. So research has actually shown that social isolation and loneliness have about the same impact to our physical health as smoking 15 cigarettes a day. So I really can't emphasize enough how important connecting with other people is. We are social animals. So what does that mean for you? What are some practical tips for doing that? Just connect, right, with people regularly and schedule the time to make it a priority, just like you would any other important thing or appointment or doctor's appointment in your calendar. Put that time in there, and the more regular it is, the better. Please know that the quality of your relationships matters a lot more than the quantity, right? The Instagram followers you have or TikTok or whatever matters a lot less than having someone that you can tell something to and be vulnerable with, even just one, right? Another strategy is just to assume people like you, right? There's a lot of literature on this. Simply going into an interaction, believing that people like you are going to like you, tends to make them like you. It's pretty interesting. People tend to like us a lot more than we think as well. So please don't let that be a barrier. Just assume that they do, because what's the worst that can happen? Focus on quality time when you're with the people that you're trying to connect with. Truly connect. This means put the phone away, right? Have designated phone as away time. If you're going to be there, right? Because wherever you are and however you are, just be there, right? And I know that's hard, but it's a practice that we can do. And finally, be authentic in your interactions. We're so afraid of showing our true selves and being ourselves, but being authentic means being your true self with all your thoughts, feelings, and whatever perceived baggage there as well. This is how we form true connections with people. And when we aren't authentic in our interactions, we aren't able to form the meaningful connections that we really crave and need as human beings. So be genuine, be yourself, right? And then do something new together, right? So the brain loves novelty. Try something new, right? If you've never been to the Birmingham Zoo, check it out, right? You've never been to Birmingham Botanical Gardens, maybe try that as a new venue, or do a sushi making class. Just do something different and don't get caught up in the same rut of watching TV. And along these lines, the peer support of the people around you matters so much for burnout. Okay, so reducing burnout and finding joy in your work. There's so much value in the shared experiences. There's just so much that happened during the pandemic and in my type of work that I know I need my fellow psychologists and my colleagues around our department to kind of bounce ideas off of and to talk about how I'm feeling. That matters so much. It's just stuff that my husband can't really fully understand as a finance person, right? So that shared feeling of vulnerability and stress can really form some of the strongest social bonds. And this is just a few, like tip of the iceberg of the studies that show how supportive our peer support really is and how protective it is for our mental health, but also our physical health. And we also know that it buffers against things like turnover and tension. And it really can help with burnout, because burnout can be contagious. So shifting the morale of the group is so important. Spiritual health. So sometimes this is the area that is often forgotten about. And trust me, I'm not talking about religion per se, okay? But what spiritual health is all about is just connecting with your beliefs, whatever they may be. And it doesn't have to be religious. If you are religious, that might mean prayer. It might mean just meditation or quietly reflecting. It could mean scripture, it could mean sacred writings, it could mean philosophy. But one of my favorite ways to connect with spirituality is to get out and experience all, right? AWE. And believe it or not, this is not as hippy dippy as it sounds. There is a lot of research going on, some great research coming out of the University of Berkeley about all and what it means and why it's important to our well-being. But it really just means tapping into something greater than yourself, connecting with the earth, connecting with nature, connecting with others, right? So you could experience this. I recently did by, I was on a vacation. We were at the beach. And I just sat and I looked at the ocean and the waves just crashing in on the shore and just thinking, wow, like that is so vast, right? This is so different than what I experience on a day-to-day basis. It's so beautiful. And recently a colleague pointed out, we were at a conference, pointed out Mars to me. It was far away, but I saw the reddish tint and we used an app to confirm that it was definitely Mars. And that was amazing. I never really thought about looking at the planets in that way, but that'll definitely make you feel small, right? And make you feel like you're a part of kind of connected to the fabric of the universe, if you will. So it sounds a little hippy dippy, but there are a lot of great papers on this and there is evidence to support that it works. So find all wherever you are. So in terms of professional wellness, everything I've talked about today is connected to your professional well-being. It's all connected to how you're going to be able to find joy in your work. But we know making a connection to the purpose in your work is probably one of the most important things. So motivation is a nice to have. Motivation is a fleeting feeling, but purpose is our life force, right? So you've got to reconnect to that purpose. Why are you doing this? To be able to do your best work and to find joy in it and be engaged. Another thing that I like is to think about increasing your task variety. So if you're doing the same old, you're feeling like a cog in the wheel, maybe have some discussions with people to talk about what more diversity you could get in your task. And along those lines, like job crafting, right? So job crafting is this proactive behavior that employees can use when they feel like changes in their job are necessary. Like when you have those mismatches that I was talking about that contribute to burnout. So talk to your supervisor or talk to your colleagues to get some ideas. What would you ideally like to be doing less of or more of, or what sounds exciting to you? And just ask, right? Because you might surprise yourself. Delegate, right? So something that can really help is you've got someone to delegate to, do it, right? And don't let the barrier be that they're not going to do it exactly like you would. You've got to let go of perfectionism here. Focus on the work activities that provide meaning for you and really think about that. Okay, why is this particular project so important for me? Let me reroute to that meaning. You can also monitor your personal well-being. Here we have the wellness well-being index that you have free access to. That's a subscription. We pay for it, UAB. And so you as staff have access to that to monitor, but there's some other ones as well. But it's important to just assess yourself, right, regularly and see where you're at. But it could be as simple as just asking yourself, like, am I feeling a little bit of burnout, right? And what do I want to do about it? So recognize, finally recognize when you need help and get it. And I'm going to have, further than some of these tips, and I'm going to provide some of those on the last slide. Boundaries, this deserves a slide of its own. This is definitely related to your professional wellness. But why are boundaries important? Because we know that employees who maintain a work-life balance tend to be less burned out, right? They have a variety of activities. It's not just work, work, work. It's I'm doing these other things that I enjoy. It's I'm talking to people that outside of work. I'm talking to people in work, right? It's a work-life blend. I'm not just focused on all the tasks I have to do and that's it. And then worrying about that when I'm outside of work. I've got a life, right? Here and at home. So there's a lot of benefits. I put some of them there. So how do we maintain our boundaries? So a few strategies. Don't sign up for extra work. If it's not necessary for your job and you're burned out already, you probably shouldn't say yes to it, right? Along those lines, practice saying no, right? Flex that no so that you can protect your yes, right? Sometimes we just don't have the bandwidth for something. And if you say yes, you might not do a good job on it. Also, sometimes if you say yes, you might be saying no to something else. Is it seeing a new milestone in your baby, right? Is it going on a family vacation where first one in years where everyone's getting together? So really thinking about when you need to say no and practicing that. We talked about delegation. Use your vacation, okay? Use your paid time off. There is plenty of research that people who don't take vacation have greater cardiovascular risk. You're at higher risk for heart disease and stroke, all right? Not meant to scare you, but there are very real physical manifestations of not getting away from work sometimes. So definitely prioritize that. Don't let perfect be the enemy of the good, right? I struggle with this myself. So does this really need to be perfect? Okay, maybe not. Maybe I can just do a good enough job on this and move on to the next task so I'm not spending an exorbitant amount of time on things. And don't respond to messages after hours if that isn't part of your expected duties, right? So just respond when your hours start the next day. So a couple resources I'd like to end with. Don't forget about the UAB Employee Assistance and Counseling Center. This place is awesome. They've got, you can get 15 free sessions a year. They do both individual and couples counseling. So if you think you need a little extra coaching or help, they are great. I've got the number there and the phone number. They also have an emergency counselor that can be reached through the number there. And then I just put some crisis resources. If you're listening or you know someone who you're really concerned about things like suicidality, or they might be in acute crisis, there's the crisis text line for UAB, as well as just the 988, which is just a very basic. And then SAMHSA's national helpline is an 800 number anyone can call and be set up with treatment pretty quick. So with that, I do want to just say thank you for you all, whether you're new to UAB or you worked through all of the height of the pandemic. I just want to say that I really value the contributions of every single person here at UAB. And I want to say thank you so much for all that you do day in, day out, and for simply continuing to show up to work, because I do know how hard that can be sometimes. But now I'll leave it up to kind of discussion. I'm going to leave my contact information up here for a second in case anyone does want my email. But yeah, are there any questions that I can answer now?
Oh, thank you, Dr. Hayes. This was wonderful. I think, each part of your presentation can be just a whole hour,
Yeah.
but it was a great overview, and people stayed and listened, and it's just full of depth and a lot of good ideas for anyone. Our staff, our faculty, our students, it's just can help all of us. If you're working in the clinic or you're working in the office or non-clinical, I think it applies to all of us. So I really appreciate you. So Mary, if there are any questions you want to present that, and we have 8 minutes, and we're going to try to get answers to the one that we don't have time for.
Yes, so we've got a few questions in the chat, and it looks like some people are raising their hands as well. Let's see. Chris Zerold, would you like to ask your question?
Yes, thank you. That was an excellent presentation, and I'm glad I attended.
Thank you.
My question about burnout is, if you are so burnt out that you have isolated yourself from your colleagues and your coworkers, what do you suggest in order to, probably some mental health help, but how do you suggest getting back into that rhythm of, making that connection with your colleagues from that being burnt out? Thank you.
Yeah, I think that's a really good question, right? Because sometimes we're not our best selves when we're burned out, and maybe that can come out as like irritability or other behaviors that can strain our relationships, and it's not intentional, right? And so I think one thing that I would suggest is just going back to people, and maybe it's one by one, or scheduling like a lunch with folks to say, like, I know I wasn't myself, or that I haven't been myself, and to be vulnerable in that way, to say, take ownership for your part. Like, I was feeling burned out, and I'm just so sorry, and I'm working on this now, and I just want to connect again, right? That y'all are valuable to me, and you're important to me, and just to be honest in that way, right? And see what you get, because like I said earlier, just assume that people like you, right? Because a lot of times you'd be surprised. Other people might be like, oh, thank God, like I really do want to reconnect with her. So just give that a shot as a first step, I would say. And it can be on a one-on-one, just kind of individually for a little while as you build some confidence to do group things again.
Well, thank you very much for your answer.
We also have a question in the chat asking, how do I tell someone to stop handing off work without sounding rude?
Yeah, absolutely. So I mentioned delegation earlier, right? And it can be a useful strategy for those of us who are burned out when there's someone to delegate to. But if you are the one that's delegatee and it's happening a little bit too often and you yourself are feeling burned out, you can test out a few phrases on what feels right for you. One might be something along the lines of, unfortunately, I don't have the bandwidth for another task right now. I am completely stretched. I'm afraid if I take this on, that the work won't be of the quality that you would expect from me. Just a simple example, but there's many different ways to say it.
We have another question asking, you mentioned work-life blend, and could you explain what that is?
Yes, so I had put in the slides work-life balance, but lately, as I've been contemplating more and I've been looking more in the kind of popular science, but in the media too, is this concept of a work-life blend, where it's like, you really would ideally not want to be like, okay, I need work-life balance because my work is so bad that I need other things outside of work to feel any semblance of joy whatsoever. Ideally, in a work-life blend, you're able to integrate like some things that you enjoy at work as well, right? Like talking with your coworkers or people that you connect with there, cracking some jokes, work that's really special and meaningful to you. And then, that's kind of what I mean by the blend, not so much of like, oh, I need to have this separate life and this separate work, right? So it can be just a little bit, it's a different way to think about it.
Are there any other questions?
I think there is a question in the chat, Mary. Does Employee Assistance CC offer telehealth visits for non-local employees?
So I'm pretty sure, so I don't work in the EACC, so this is a Tammy Long question, but I can guarantee you, and I have their number back here, but I can guarantee you if you reach out to the EACC through that number or through their email that they can answer that. My thought is yes, because they definitely offer telehealth visits, and it's for anyone with a UAB paycheck, right? So I would think the answer is yes.
They absolutely will do remote. It's not Zoom, but they do have a system that they absolutely do that with employees, because most employees don't have the ability to get out of their office long enough to go do that.
And there's designated space, by the way, in the UAB Medicine Office of Wellness where I work, for people who don't have a private workspace. Maybe you're in a cubicle and you want to do those virtual sessions. We have space that employees can come to and use and have private office.
I see Monica Henderson has a question, and I think this will need to be our last question.
Okay, sure.
I've noticed a lot of talk has been centered maybe around resilience and sticking through it and finding other ways to address your burnout. Say, for example, you've done all that you can for yourself, well-being, sleep, exercise, health, and you've addressed with your employer, your supervisor, all the issues that are affecting you at work. Do you perceive that at some point that burnout does exist? You have no control at your job, and like how to recognize when to kind of just move forward and, take the next chapter and, close the book on this one.
Yeah, Monica, I mean, thank you for bringing that up. I mean, you hate to be like, quit your job, right? But, sometimes when you've gone through like everything, like those 6 factors that I mentioned earlier, and you have kind of done everything you can at an individual level, you talk to your work, you talk to your supervisor, nothing seems to give. Sometimes at that point, we do need to consider a job shift, right? Now, that might not mean leaving the institution entirely. It might mean, okay, I need to maybe get a transfer, go to a different division where I think it's going to be a better match for me, right? Because it's about that mismatch oftentimes. So you might be able to find work you do enjoy in a different area. Or of course, sometimes you just need to, it could be even the field you're in, or that what you thought it would be isn't working for you. And so you've got to find something new. And I think it's at that point you already mentioned, you've gone through all the 6 main factors of mismatch, you've done everything you could, you've talked to people at work, and it's just not working.
Thank you.
Thank you, Dr. Hayes. We really appreciate all that you've shared with us and the time that you've given to us. And thank you everyone who was here.
Thank you guys so much.
Thank you.
Just look for a recap and the recording in HearSync newsletter.
Thank you.
Okay. Bye, everyone.